Hi, welcome to the nice episode of the Javid Podcast. Today, my guest is Dr. Amy Bus. She's a medical doctor who's actively involved in research with particular interest in reducing the contribution of healthcare to climate change. She graduated from the University of Cape Town with distinction in medicine and is currently pursuing a Doctor of Philosophy degree at Oxford as a Rhodes Scholar. Welcome, Dr. Bus.
Thank you so much for having me.
Yeah, I kind of gave you a brief introduction, but there's so much more that happened in your life. So please feel free to introduce yourself in your own words.
Great. I think you did a fantastic job. But as you said, I am from South Africa originally, trained as a medical doctor at the University of Cape Town. After that, I worked for a few years. I worked on the front line during the COVID pandemic, which was an interesting experience. And that actually made me quite interested in the environmental connections between health and climate change and nature. And so I left clinical medicine to embark on a PhD that I'm currently doing at the University of Oxford, exploring how we can make healthcare more sustainable from a planetary perspective.
That's super cool. I guess we'll jump right into questions, beginning from your medical background. First of all, can you share us what inspired you to pursue a career in medicine, and what were some of the pivotal moments during your medical training or education that kind of shaped your current path?
Yeah, good question. So I think growing up, I wanted to do a whole range of things. At one point, I wanted to do engineering and then accounting and then law, archaeologist, etc. But I eventually settled on medicine, partly because the content really interested me, understanding the human body and how disease impacts it. But I also really wanted to help people, and I felt that that was a good way to do it. I liked the interconnections between the sort of socioeconomic lifestyles that people live and how that impacts on their health as well. And I think those were some of the key learning factors during the course of my medical degree that actually shaped where I am now. So it was this realization that depending on where we live and how we live and what things impact on us, it actually impacts our health a lot. And so unpacking those sort of drivers, and now particularly that interest in how climate change and the environment is impacting on that, was a really pivotal moment. And then I think just understanding how the world works. It's often not a pretty place, and especially working in South Africa, where you often have a lot of trauma and HIV and tuberculosis. I think there's a lot of gaps in medicine that still need filling, and especially that sort of injustice between clinical conditions in the global north and the global south, and how we interact with those, I found really interesting and quite scary as well sometimes.
That's very cool. And you said you worked for a few years and before pursuing your PhD.
Yeah.
What made you, and you ended up becoming a Rhodes Scholar, which is a very one of the most, if not the most prestigious scholarship. What made you kind of change directions that in that way, and decide to pursue a PhD, decide to apply for? How was the process actually in the first place, applying, being selected, and how do you think that impacted your current professional and academic kind of journey?
Yeah, no, great question. So it sort of was an opportunistic thing that happened while I was working. So as I mentioned, I worked during the pandemic, and sort of overnight we shifted from using reusable everything, so gowns, devices, etc., to single use everything. And the waste that we produced in that process just escalated. So I can remember one particular case. I was working in anesthetics at the time, and we had a patient who'd suffered a multiple gunshot wounds to the abdomen, and we had to rush him to theatre for an operation. And because it was COVID, we also had to wear all of the gowns and do all of the testing and everything. And by the end of that case, we'd filled 5 red bags full of medical waste. And I can just remember my tired brain just thinking, this is not right. This is not sustainable. And I come from quite an environmentally conscious background. And so that disconnect between how I was living life at home and how I was living it at work was really jarring, I think. That coincided with my application for the Rhodes Scholarship. And so when I applied, I told them that I wanted to research this in more detail. I wanted to explore how healthcare practices were impacting on the environment and contributing to climate change. And so that sort of fed into my application process. The Rhodes application was probably one of the most brutal things that I've ever gone through. And I say that having worked in the pandemic as a doctor. So, because it was online at the time, the applications, because of the pandemic, we had to do, I think, 18 interviews with people online. So, this was obviously after we'd done the physical application. And so every panel member had to have a one-on-one with you. And then we had two large interviews, one at the provincial level and one at the national level. And they asked everything from how would you fix the health system to if you could only do business with China or America, which country would you choose?
Oh,
And
wow.
it was a range of sort of really political questions right down to personal, how have you shown integrity in your life type of thing. And so it was an amazing opportunity because it really made you think about who you were as a person and what you wanted to contribute to the world. And the experience now of being a Rhodes Scholar in Oxford has absolutely been life-changing. It's transitioned me from a clinical career into an academic and a policy career. It's allowed me to meet people from all walks of life, all around the world, gain experiences across different disciplines, and join a cohort of really quite incredible Rhodes alumni and students at Oxford at the moment. So been an incredible experience and has certainly opened doors. But yeah, the application was quite brutal.
If you will. Well, that's very fascinating. I have a few questions from what you said.
Hmm.
It's well, obviously your genuine interest in what you want to do was a main factor in you being selected, right? But how do you think you navigate like that process, navigated the questions? Because you said they ask quite, difficult and sometimes politically charged questions. How do you think you just managed to like navigate it so smoothly to, eventually do well enough to be selected?
Yeah, so I mean, to backtrack, it took months of preparation. So, I mean, I downloaded about 6 different news sites and every day would read news from all around the world and, sort of preempted what I thought they might ask and thought about how I might answer it and stayed up to date with general affairs, both within South Africa and broader at the time. So it took, I think, a lot of preparation to reach that point.
Mhm.
And also the idea that I knew what I wanted to study in Oxford, I think helped quite a bit. But then during the interviews, I think it was just about honesty. There is no right answer. Whether you want to do business with America or China, like there is no right answer. It's just about how you think about those things and how you portray yourself and how honest you are. And for the most part, the committee knows when people try to give answers that they think they want. And so that's never really a good practice, I think. So that sort of honesty, genuineness, letting your personality shine out, I think really helps. And telling a story about how Rhodes fits into your life trajectory and how you'll use it to better the world, I think is how to tackle it.
That's true. And you said you made a transition. It helped you to make the transition from clinical medicine to academic medicine. Do you want to go back to clinical medicine, or do you think you want to pursue a career in academic medicine and eventually maybe become part of the government public policy sector?
Yeah, so I mean, there were some good things about working in medicine, but a lot of the time I felt like I was just another cog in the system, and a system that is quite broken in many instances, not just in South Africa, but globally. And so I do think I'd rather now get out of that space and work more at the higher strategic level. So I'm really interested, I think, in spanning the sort of academic and policy space, but now specifically at the intersection of climate change and health, because that's really where I think the pressing need is at the moment.
That's great. We'll go back to your future career
Yeah,
aspirations, but
sure.
you're currently pursuing a doctor of philosophy, like a PhD in translational health sciences, which sounds really cool. Could you explain like what that entails and like why did you choose to specialize in that? I don't know how through Rhodes you come up beforehand with the programs that you want to study, or do you choose after being selected as Rhodes? I don't know how that works, but what does translational health sciences entail, and what does your typical week look like? What do you do in your research?
Yeah, sure. So to start, how Rhodes works is that you get the scholarship and then you apply to Oxford. So you don't necessarily
Mhm.
have to apply to what you said in your Rhodes interview. But nevertheless, I ended up applying for the DPhil in Translational Health Sciences. It was a brand new DPhil at the time, so I was one of two people who was the first cohort of that DPhil. Also, just to say that DPhil is just the Oxford term for PhD, it's exactly the same thing. But the Translational Health Sciences specifically filled this gap in translating evidence into practice, and this idea that there's a lot of research that goes on in the medical field, but it doesn't always get implemented how it is expected to. And so it brings into play a lot of the sort of external factors like politics and economics and technology and behavior change and everything that is needed to actually implement some of the stuff. The reason why I applied for that one is because there aren't many DPhil programs that look at the intersection of climate change and health. In fact, I think when I started, I was the only person looking specifically at the sustainable healthcare aspect of it. And so I felt as though this was the best place to slot myself in because it was quite an interdisciplinary program. How my daily week looks, it definitely varies by week. So a lot of the time I'm reading articles, writing my thesis. So I'm in my third year of my PhD at the moment. And so I've done all my data collection and interviews and all of that. So now I'm analyzing that and writing it up. So that's a large proportion. Lots of meetings, so department meetings, meetings with people who are interested in similar things, do quite a bit of teaching, attending conferences, presenting papers, that sort of stuff as well. And the nice thing about doing a PhD is that you also have opportunities to take part in other projects. So sometimes I'm working on other research, writing papers with other authors, and working on sort of policy stuff as well. So it's a very varied week, but I think it's great that it brings that variety to your life.
That sounds really cool. And I guess I'm curious, being part of such a new, but first of all, I feel like there are very few programs, if there are any really, in the world that look at the intersection of sustainability, medicine, healthcare, right? So your program, your research area overall is very novel research area, but that program, DPhil in the Translational Health Sciences, being part of such a new novel program and being part of just like the two people, as you mentioned, doing research and that, how does it feel? Do you feel like you get enough support? Do you feel like you have enough access to resources? How do you navigate just being the kind of the persons that explores the uncharted territories of the new research area,
Yeah, it's interesting. So there are times where I do feel like I am the latter, which is kind of exciting in itself because it's a lot of sort of self-directed learning and knowledge discovery. But having said that, there's a lot of, I guess, collaborations at the University of Oxford that, although they might not necessarily look at the intersection of climate and health from the sustainable healthcare aspect or angle, there are lots of people looking at climate change, and lots of people looking at health, and lots of people looking at sustainability. So you can sort of learn from other people, even if they're not doing exactly what you're doing. So that's really cool. I also have great supervisors from all around the world, actually. So it's not, I'm not just dependent on the resources at Oxford. And then I guess it's also about being the advocate in the space too. So I've just come off a week of teaching on a brand new sustainable healthcare course that my supervisor and I co-ran together. So I guess leading the way in some of this education as well.
That's really cool. And your current research explores the impact of health systems on the environment. Um, what are you like? How do you conduct your research? What are you looking at? And I guess what are the main key findings you have found so far?
Yeah, so I mean, that's sort of, I guess, the broad space that my research fits into. I'll come to what exactly I'm looking at.
Mm.
But I think just to give a bit of background on the space, so we know that health systems or healthcare impacts on the environment in a range of ways. So they have quite a high carbon footprint. About 5% of the world's emissions comes from healthcare. It has a large waste production, as we saw from the pandemic, but also because a lot of the stuff that we use in medicine is single-use plastic that we use once and throw away. You have impacts on water sources. So health systems use a lot of water, they use a lot of energy, but they also leak. chemicals, pharmaceuticals into the environment. And so that has an impact on ecosystems and human health as well. So it has a range of environmental impacts that I don't think we necessarily think of all the time when we practice medicine or receive it. But people are increasingly concerned about these interconnections. And so that's the sort of broad space that I went into. I'm particularly interested in the impact of pharmaceuticals because drugs contribute a significant proportion of health systems' carbon footprint. So in the UK, about 20% comes from medicines and chemicals. If you look at the Chinese carbon modeling, about 55% of it comes from pharmaceuticals. And a lot of that is produced at the industry level, so where drugs are being manufactured and distributed, etc. So my specific focus is looking at the carbon footprint of the pharmaceutical industry, how they're reporting their climate impact, how they're reducing it, how they're progressing to net zero, and the sort of politics and economics and societal issues that come in the way or enable them to do so.
I see. I'll ask more questions on that, but one thing I'm curious about is, like when we talk about sustainability, and it's talked about a lot right now, but people mostly focus on like big corporations, oil, gas, all that stuff. And I feel like healthcare is not talked enough, probably because not a lot of people are, fully aware of the extent of how much healthcare contributes to the issues, to climate change. So one of the questions I have is, how do you transition, like how do you implement the academics findings, the research on a larger scale, where like on a policy scale or economic scale, and how do you go about like informing the general public? Because I feel like research is usually not quite accessible, either due to the language or perhaps due to you have to have access to the journals and magazines, right? How do you make sure that the research that you do also kind of like reaches the public and becomes more like widely accessible and available?
Yeah, I mean, I think that's applicable across all research, not
That's
necessarily
fair.
just mine. So, I mean, there's multiple ways to do it. I think writing in journals is one thing, but you're right, a lot of that only gets read by the academic population that is interested in that subject. Another way to get it out there is the media. Having said that, the media also sometimes spreads a lot of disinformation. So it's about, I guess, choosing which journals, media journals you want to go with, and ensuring that the journalist who is engaging with that research has the correct scientific facts. Podcasts like your own are also a great way of getting
Yeah.
research out
Yeah.
there. In terms of getting it onto the policy agenda, I think that can be quite tricky sometimes, especially when you're dealing with different political agendas. But there is definitely a big drive towards climate action because we're seeing the effects of it more and more. And there's a much bigger drive towards looking at it from the perspective of healthcare as well, because we're realizing that the climate crisis is a health crisis. COVID helped in a way because pandemics are going to be driven more and more by climate change. But equally, we saw how much damage we were doing to the environment during the pandemic with all the waste that we produced. And so often in conversations with people, because word of mouth is also a great way of getting this information out there. So often in conversations with people, I'll tell them, I'm interested in sustainable health systems. And the first thing they'll say to me is, oh, yes, why do we always use so much plastic in healthcare? And I'll go to my doctor and they'll use like lots of gloves and everything. So I think it's a very visual way of getting the message across that this is an issue as well. So using all of the avenues that you have is a way to get it out there. And then just engaging with policymakers and trying to get it onto the political agenda. It's
That's,
challenging, but
yeah,
it's what we need to
always.
do.
And like how are you saying you go about like looking at the developed and developing nations, right? Obviously, there are significant differences. How do you go about implementing those changes when it comes to those different states? And also, how do you think like in the coming years, how do you think the relationship between the healthcare practices and environmental sustainability evolving? Like, in what ways do you think you will see changes? And I guess another question. I know I asked a lot of questions. I'm happy to repeat myself, but like, what critical steps, in your opinion, that need to be taken to embed sustainability in health systems?
Yeah. Well, let's start with the developing and developed question.
Mhm.
So I think there's multiple aspects when you look at the intersection of climate and health. So the one is adaptation. So that's this idea that we know that climate change is going to affect our health more and more. And unfortunately, it is disproportionately affecting the health of people in less well-developed countries. And so in those settings, it's about adapting to those changing disease profiles. It's also about resilience of health facilities. So when we think about how our health facilities are going to be affected by flooding or by fires or by earthquakes or extreme heat, have we thought about how we deliver healthcare in those settings? And as you know, I came from South Africa, and about 2 years ago, we had massive floodings in the place that I was from and in the hospitals that we worked in. And you just can't deliver healthcare when you can't get to a health facility and when it's underwater. So part of it is about thinking how facilities become more resilient to those insults. The sustainability aspect, I actually think applies more to global north developed countries. I'm not sure I like these terms, but I'll use them for simplicity's sakes. But a lot of the impact comes from countries that have lots of resources and use lots of resources, and in some cases deliver unnecessary levels of care. It's what we call wasteful clinical practice. If I think in some of the facilities that I worked in the past, we weren't using much energy, we weren't using much water, we were using mostly reusable items. So in that sense, the environmental impact is actually a lot less. And so we can actually learn across different health systems about how we can deliver healthcare in a more efficient manner, frugal, more sustainable, better for the patient, better for cost, and better for the environment. And so transferring those lessons across. Having said that, I do think all countries and all health systems have a responsibility to play, and it's not, the case that we can just put all of the onus on developed countries to change. There's a lot to be said about developing countries leapfrogging. So, for example, going straight to renewable energy and cutting out the coal-powered industrialization and development that they need. So that's one element of this. How I see environmental sustainability being built into healthcare, I think we sort of need to change our perspective and realize that health is so intertwined with the environment and with climate. And so because the argument that I often get told is that no, as health systems, we don't need to think about the environment because we're saving lives. But we need to realize that you can save lives, but also help the planet. And that actually helping the planet saves lives in the long run. So changing that sort of mindset is part of it. I think there's a lot to be said about the sort of top-down, bottom-up approach. So getting it onto policy agendas, getting into hospital management, seeing if we can change infrastructure, energy use, water practices, procurement, etc., is one element of it. But then also bottom-up initiatives like using less when you're practicing medicine or prescribing more sustainable drugs or speaking to your patients. So that sort of behavior change stuff that happens on the ground, I think is also really important. As you mentioned, a lot of this is about creating awareness and education of it. And I think that's a big gap at the moment. So tackling that is one element of it. But yeah, so once that's tackled, then it's about finding those low hanging fruits and blending the policy and the practice across the board.
Fascinating. And you said your focus mainly is on the pharma industry's contribution to the.
Yeah.
So what kind of, first of all, where do those, the contributions come from? Like, is it the technology? Is it the production part? And you mentioned sustainable drives, which is also a very interesting term. I think it's the first time I've heard of it. What do you mean by sustainable drives?
Yeah.
And also what kind of changes or actions would you like to see there to decrease, pharma's contribution precisely?
So I'm not sure how familiar you are with calculating carbon footprints, but when companies and organizations, countries report their emissions, usually it's reported in 3 scopes. So scope 1 and 2 is your energy use within organizations. So it's the lights that you're powering in your room, for example, at the moment. That's your scope 1. And your scope 2 is all of the emissions from producing that energy and distributing it to that facility. Everything else is your supply chain. So it's your distribution, it's your purchase goods and services, it's your employee travel, your business travel, investments, etc. So most organizations, countries, the bulk of their emissions sits there in their supply chain, which then becomes quite tricky because you're now a company that needs to reduce their own carbon footprint, but you're reliant on your suppliers to do the same. And so to jump to the last part of your question, which is how can change happen, it's about getting all of those suppliers on board to actually reduce their emissions from the outset. The other sort of low-hanging fruit that companies are engaging with at the moment is switching to renewable energy, using electric vehicles. Obviously, that's easy to do in countries that have renewable energy infrastructure and electric vehicle charging points. It's a bit trickier to do in countries that don't. And other things that they're doing are engaging in what we call green chemistry. So it's trying to find ways to produce drugs more efficiently, be that continuous batch manufacturing, so manufacturing multiple drugs at once, or switching from solvent use to enzymes. So that's a lot more better for the environment. Finding green distribution networks, so actually using AI, for example, to map out what would be the most sustainable transport route to deliver their drugs. Packaging, so can we reduce the size of packaging? Do we really need to put all of our drugs in those plastic blister packs, for example? And then you asked about what sustainable drugs mean. So that's an interesting question because we're not entirely sure yet because we don't have the data. But if I can give you one example that we do have the data for, it's inhalers. So inhalers that we prescribe for asthma or lung disease. And usually you'll be familiar with the ones that you puff into the lungs. And those actually contain a propellant that is thousands of times more carbon or emission intensive than carbon dioxide. And there is another version of an inhaler, which is a dry powder inhaler. So instead of the propellant, it has a powder version. And so it's much more environmentally friendly. And so there's now a drive towards switching from those pump inhalers to the dry powder inhalers. So in that sense, it would be sustainable prescribing because you prescribe according to sustainability. We can have a longer chat about prescribing because obviously you need to take into account cost and clinical indication and patient side effects and everything. But there is increasing interest in how we can incorporate the environment into that decision-making process. As I said, we don't have the data for most of the drugs that we prescribe. So that is another research on the horizon is can we actually figure that out and then incorporate that into prescribing practices?
That's really cool. And actually, one of the things you mentioned really plays well into the next question. How do you see the new technologies? The rapid advancements in AI and the language models and everything is AI now, right? Do you think the new technologies, if they can at all, be used to address the issues, the sustainability issues you see in healthcare?
Yeah. So I think technology and AI is a double-edged sword. Mm-hmm. So it does have advantages, but I think we need to think really carefully about what and how we apply some of this. So good examples that I've seen are, can we use AI to discover drugs, for example, and take out some of that drug discovery process that takes a long time and actually use platforms to find molecules that will act against diseases? Specifically within clinical practice, can we use AI to help with identifying tumors on x-rays, for example, which would increase the efficiency and time as well? Can we use technology to conduct virtual consulting where a patient doesn't have to travel in to have an appointment, which would reduce travel emissions, for example, and be more sustainable and cost less? These are all great, but they have letdowns as well, for example. So if you look at the virtual consulting idea, it's great, but there's only so much you can do virtually. And in my opinion, if you are diagnosing a patient for the first time, it's probably better to do that in person when you can physically examine them. So this sort of push to latch on to all things technological and innovation and all of that, I think it needs to be done with a little bit of care. The other thing that I will say is that technology has an environmental impact itself. So especially when you think about AI and your big data centers, they pull massive amounts of water and massive amounts of energy, to the point where some local communities worldwide are without water and energy. So we need to think about the environmental impact, the patient impact, the monetary impact, and balance the sort of pros and cons and trade-offs in the space. So I think there's potential, but we need to think carefully about how we apply it.
That's very fair, very interesting point. I want to go back to the might be a bit kind of different question, but I still want to ask your opinion because you worked during the COVID time, and I feel like COVID, the pandemic, sustainability itself is very, it can become weirdly very politically charged, right? And on one hand, like during the COVID pandemic, we saw how fast science can act to develop a new vaccine. Before it would take forever to come up with new vaccines, but it was done very rapidly. But on the other hand, we saw a rise in many parts of the world in anti-vaccine sentiment, anti-science sentiment. And I feel like there's this similar sentiments when it comes to sustainability and the climate change too, right? Why do you think, what are the main contributing factors to that besides the political, the manipulation? And also, how do you think we can kind of increase the trust of public in science? And actually, science tends to be the most objective thing when it comes to, what do you think, what steps can be taken to alleviate that problem?
Yeah. I mean, it's a tricky one, and I think you're always going to have a population that has differing beliefs and ideologies, and you're never going to get everyone on the same page, unfortunately. So I guess it's about how can we take the bulk of the population towards what we think scientifically is where we should be. Political messaging does play a huge part in that, and so having a politician that stands up on your stage and uses the evidence that science is saying and speaks about it in a coherent manner, I think goes a long way. Obviously, we saw in some countries that was not the case. No countries mentioned. I think the media plays a really important role as well. And again, you're never going to get every media source on board because sometimes misinformation and conspiracy theories sell. But if we can try and put measures in place to at least limit that to an extent and actually foster this collaboration between scientists and researchers, academics, and the media, I think that's really important. Researchers and academics can sometimes be notoriously bad at speaking about their research. So if we can actually get media training more a prominent part of that, I think that could also help. It's often about telling a story and removing that jargon from it that makes it quite difficult for people to understand. I think fear plays into this a lot, and that we especially saw during the pandemic was people were scared, and so it was easy for them to latch onto these conspiracy theories to avoid having a vaccine that they didn't really know where it came from and what was happening. The other thing that I will pick up on, because I noticed it a lot in South Africa, is this sort of, and again, I really don't like these terms, but this global South, global North, West, anti-West sentiment. Because a lot of countries, especially those that were ex-colonies, are a bit tentative about accepting blindly what other countries tell them to do. And we saw that a lot during the pandemic, and we also saw a lot of things like vaccine hoarding and, not helping countries out when they needed it, putting countries that didn't really deserve it on red lists. So that sort of political tensions between countries, I think, doesn't help, really doesn't help. So there's a lot of factors that come into play, but I think clear communication, policies in place that limit what media can and can't say might be helpful, and just really trying to tell a story honestly is probably ways that we can help alleviate that.
That's fair. You mentioned a couple of times, so I am very curious to ask. You said you're not a fan of global North, global South terms. Well, what do you think should be the alternatives, and why do you not like those terms
Oh,
much?
I honestly don't know. I mean, I think it sort of lumps an entire half a continent into a sort of preconceived stereotype, which
Mm-hmm.
doesn't apply because countries are very different and
Mm-hmm.
have nuances to them, both good things, bad things, in both the North and the South. But having said that, it's an easy heuristic, and most people sort of understand the gist when we refer to them. I honestly am not sure what terms would be better, because I think every term you apply has some sort of connotations. I mean, you could speak about third world, you could speak developing. It's tricky. Language is challenging.
That's fair. Dr. Bruce, if there are a lot of people, young people who want to get into sustainability, and if there are people who want to get into sustainability from a more healthcare standpoint, what advice do you have in terms of if they're aspiring to get into research, policy side? What are you saying? Like, what advice do you have for that, as somebody who's going through that yourself?
Yeah, I mean, I think everyone can and probably should get involved in sustainability to some extent. So, I mean, you can always do sustainability at home. If you're specifically interested in it from a healthcare perspective and are working in a health facility, I think there's a lot of opportunities to implement and take part in sort of these bottom-up initiatives, be it simple things like greening your operating theatre, or, I don't know, making sure that people throw the right waste into the right bin type of thing. So there's a lot of small things that you can do to get involved. If you're looking at moving, I guess, more into the research space or the policy space, I think it's just about upskilling yourselves in those areas, looking for what programs, educational, master's, PhD programs are on offer, and just going for them. A lot of these things obviously require funding, so exploring the scholarship bursary space as well can be quite useful. Sending emails really helps. I cannot express enough how much just sending an email. So if you find someone that is working in a space that you're interested in and you want to learn more, just send an email, be it maybe a policymaker that you think is doing great stuff in sustainability and you want to help out, or someone who's not doing great stuff and you want to push them a bit. I think there's a lot of ways to get involved and push the agenda.
That's fair. Dr. Rhodes, where do you, if you don't mind me asking, where do you see yourself in the next 10 years down the line as your career progresses?
You know what, 6 years ago, maybe I was one of those people that planned out my life to the last second. But that has very much changed since working in the pandemic, because I think you really realize how short life is and how it can change like that. And 3 years ago, I never would have expected that I'd be doing a podcast with you from the University of Oxford. So, I mean, I think life changes so quickly, and planning it out, I can't say where I'll be in 10 years. Having said that, where I'd like to be is maybe working in some sort of academic policy, NGO, third sector, industry portfolio career, where I blend climate change and health research and engagement, and try and work in that space to drive the agenda forward. That would probably be the ideal.
That's fair. And you mentioned NGOs, and how do you see NGOs and entrepreneurs in this field coming into play? Right, like, do you see active entrepreneur pursuits that apply to your research area, and any prominent NGOs that work in an area similar to your research?
Yeah, so the big global one that you might have heard of is Healthcare Without Harm. They started, I think, in 1996. So they've been around for several decades, and they specifically look at how we can make healthcare less harmful to the environment. And they have global facilities around the world. There's a couple in the UK, like the Centre for Sustainable Healthcare, the Sustainable Healthcare Coalition. I think there's probably some in America, but I'm not too clued up on that in that space. So I think it's a really nice ecosystem of social movements and NGOs that are helping to drive this agenda. The entrepreneurial space is always interesting, because I think we do need a lot of innovation. I'm always tentative about that word as well, but we do need new ways of thinking about these things and doing these things, and so there is a space in that, the entrepreneurial world too. So I think every player needs to come on board to some extent, and together hopefully we can help to make it better.
Yeah, Dr. Bruce, it was a very informative episode. I learned a lot. especially because you hear about sustainability a lot, but it's always on the news. And I feel like you really need to delve into specifics to really understand the issues and to know how to fix them, right? Or how to contribute positively. So I really appreciate your time and your words. I guess any final words of advice or wisdom to our viewers?
Oh, it's always a tricky one, isn't it? Well, I mean, I think in life, what's really important is trying to find this balance between what you're interested in, but also what the world needs. And if you can slot yourself into there, then I think you're doing very well in life. It's not always easy, but that would probably be my advice.
That's a fantastic advice. Thank you so much, Dr. Amy.
Thank
And
you so much.
I hope we can stay in touch and good luck with your research. And I hope to see more news and more research from you in the
Yeah,
coming
yeah.
years.
Thank you so much for having me on. It's been a pleasure.
Thank you. Bye bye.
Bye.